Hi, everyone. Good evening, if that's the evening where you are. Good morning, if that's the time where you are. Good afternoon. It is indeed, I hope, a good day. We are talking about children and the COVID vaccine. So I do indeed think that it is a good day because we are finally having ages 5 to 11 vaccinated. And I say that as a parent of someone precisely in that age group. My name is Mitra Kalita. I am the publisher and founder of Epicenter-NYC. We launched as a community newsletter. We've evolved into so much more. We're a community journalism initiative. We publish 4 newsletters a week, a podcast. We have multiple community engagements, mostly in Queens, but we serve folks in Brooklyn, and as a result of those 2 boroughs, certainly all over the world. And we also do conversations and convenings and live streams like this one. It's really, really great to be here. We've not done a live stream in a few months, so those of you who are tuning in, welcome back. If you're catching this on a replay, it's really good to see you that way too. And we do hope that you stay in touch throughout the show, but also, follow us and let us know how we did and keep us posted. Tonight, we're joined by pediatricians. We have one pediatrician with us. We might have one more joining us, and we're just going to go with it if he is able to join us later. But we definitely have Dr. Ozak with us. He is a pediatrician and president of the Woodland Park Pediatrics in Woodland Park, New Jersey. He attended the University of Notre Dame and then received early admission to medical school in Bangladesh, so attended Bangladesh Medical College. Dr. Ozak completed his pediatric residency at UMDNJ, now Rutgers University in Newark, New Jersey, Rutgers being my alma mater as well, and is a diplomat of diplomat of the American Board of Pediatrics. He's a fellow of the American Academy of Pediatrics. Manan and his wife, Nadia, who I heard briefly backstage and is right by his side, is also a pediatrician. So she will be keeping him honest behind the scenes. They share a private practice in Woodland Park and live in Caldwell, New Jersey, North Caldwell rather, with their daughter. He enjoys traveling, so we will ask him about that with families in the time of COVID and so much more. So I want to welcome him, but I also want to just give us a little background on why we're doing this, how we come to you, and what we, kind of want to do from here on out. We're co-sponsoring this program with our partners in a vaccine equity program run by the City of New York. Epicenter is joined by 2 organizations, Clear Health Costs, which talks about the cost of healthcare since COVID-19. It's entirely pivoted to coverage of the pandemic. And the other organization is our co-host for this evening, TBN24. TBN is their studios are just a few blocks from me here in Queens. They are the best neighbors. We've worked with them a lot at Epicenter. I'm really, really grateful to them for this partnership. And our work is made possible by a grant from the Fund for Public Health in New York City and the New York City Department of Health and Mental Hygiene. We'll be doing this program in English, but it will be shown later on TBN24. So if you're watching on TBN24, thank you for joining us. Ami ektu Banglajani, but we will be speaking in English tonight. I will ask Dr. Ozak to deliver a message in Bengali to our parents at the end and families at the end. So do stick with us for the program. Just a reminder, we will be monitoring the chat for questions. So if you have any questions related to kids and the COVID vaccine, other questions about families and kind of this very confusing moment in time, please do follow the kind of guidance on the platform that you're watching us on. So if it's on Twitter, hit reply. If it's on Facebook or YouTube, just put it in the comments. So now that we've gotten all that housekeeping out of the way, but really do want to hear from you, I think it makes sense to bring Dr. Ozak on, and maybe we could just start with the basics of the vaccine. So if we could just have him join me here. There you are. Hi, Dr. Ozak. How are you?
I am good. I'm good. Thank you very much, Mitra, for having me here.
Oh, thank you for being with us. And I do feel like before we dive into the basics of the vaccine. I feel this need to share this personal connection I have to you, just so people know why I trust you so much to bring you on tonight. So
Sure.
about a year and a half ago, in the spring of 2020, a very dark time, if you'll all remember, and a very confusing time, I thought my daughter had COVID. And I was living in a house with two elderly people in New Jersey. As you all know, like getting a test was impossible. And so I turned to another friend of mine who's in palliative care, which, I mean, no offense to him, but that's not really the type of care I want at this stage of my life. But I said, I don't know what to do. I'm so afraid for my daughter. I have these two elderly people in the house. And he said, well, my brother's a pediatrician. Do you want to talk to him? And so that's how I met Dr. Ozak. I want to thank you for getting us through a really difficult period where we still don't know if she ever had COVID. But I am very happy to say that my 16-year-old, who is the person in question, is vaccinated. So anyway, so it's great to see you, because in that period, I think I was like giving you a lot of panicked phone calls and text messages. So we're in a much better time today on all fronts. So I just wondered if you could give us the basics. Can you tell us precisely what ages are now eligible for the vaccine, and what type of vaccine they will be given?
Sure. So the only one approved right now for kids 5 and up is the Pfizer vaccine. And the within the last week, we got the approval for 5 through 11. And prior to that, we had the approval for 12 through 16, 12 through 18. So right now, we can vaccinate all of our younger kids, school-age kids from 5 and up. And Pfizer is the only one that has been approved through the EUA now.
And is it the same dose of Pfizer that, for example, that my 16-year-old got? How is this Pfizer for ages 5 to 11 different from the Pfizer we've been talking about all along?
It's the same vaccine, but the doses is actually a third of the dose from 12 and up. So the adult or 12 and up dose is 30 micrograms. The 5 through 11, with all the studies they've done, that 10 microgram is shown to have enough efficacy and, of course, safety profile.
And how do we know, this is, again, I'm just going to keep it super basic to start,
Sure.
but how do we know that this vaccine at the dose that you're talking about is safe for children?
So, what they initially did was they recruited some volunteers for these trials, and they looked at what dose would be sufficient to provide the immune response that was needed. So again, they had the 30 micrograms, and they worked their way down to see how low can they go with the dosing to still provide the immunogenicity that was necessary.
No, go ahead.
Once they saw that the 10 microgram was sufficient, that's when the trial started with the 10 micrograms.
So I was just going to ask, like, we talk about trials a lot. I'm just wondering if you could help people picture what that means. Is it literally just average children going in and?
Oh, yes.
Yeah. So how
That's
does that work?
exactly what it is. So Pfizer, Moderna, and Johnson & Johnson, they have on their website, if you go on their website, you can look for clinical trials for vaccines. And this is anyone. Your child, my daughter, can see if they're eligible, volunteer to participate in these trials. And again, it's not a select few. They're looking for all cultural, all races to participate, and of course, all the ages.
And is it a diverse group of people? I think sometimes, certainly at Epicenter, we'll hear, well, was it only the people who signed up to do it? Or were there Bangladeshi people involved? Were there Black people involved? Were there Latinos? How does that work?
So again, it's the population that is volunteering. So, maybe we need to speak to our Bangladeshi population and say, listen, we need to be represented. So our families have to volunteer. So from what I've read, of course, our country is 330 million people, and most of the country is Caucasian. So yes, you're going to have a larger population of Caucasian kids in these trials. Same thing with whether it's Caucasian, Latino, African American, and of course our Deshi population. So if our families are willing to participate in these trials, they actually will have to go on the company's website and say, listen, is there a trial next to me that my child can participate in? And because of the pandemic and so many families involved, including the world, people were there. People were there to volunteer and to see if we can get out of this pandemic and get this vaccine going.
I think that's a really good point, because I mean, here in New York City, I think I did hear from some parents saying they were driving their children as far away as Connecticut, some into New Jersey, to be a part of these trials. So, I do know some families who partook in that, and everyone was very jealous of them because, their kids were getting the vaccine in some cases before grownups were getting the vaccine. So it was it's pretty cool.
Again, we're talking about being safe and being able to go back to where normal humanity was. And that's what our vaccines are going to be providing for us to go back to that. And yes, I'd like to get that first vaccine and be able and understand that I have the protection. We still need to, have our safeguards, but yes, that 90% effectiveness of these vaccine, 95% effectiveness of this vaccine to prevent us from getting it or getting severely sick from it.
So if you're just joining us, I just want to remind you, this is an Epicenter TBN sponsored discussion. We're with Dr. Ozak, who's a pediatrician in New Jersey, talking about kids and the COVID vaccine. Please do give us your comments, your questions. We're monitoring chats for that. So if you're on Twitter, you can hit reply. You could do comments on YouTube or Facebook if that's where you're watching. We'd certainly love to hear from you. If you're watching this later, we can also monitor the comments and we'll try to get in touch with you. But it would be great if while you have the doctor, we do take advantage of that. So just again, while we were on the basics of the vaccine, so we know that it's Pfizer, it's a third of the regular dose of grownups. Does it also work the same way? So remember the three vaccines that are out there right now, at least in the US, you have Pfizer every 3 weeks, Moderna every 4 weeks, both doses, and then J&J, which is like a one and done. You just take one shot and you're done. So for children who are taking the Pfizer vaccine, what is the recommended number of doses? How do the logistics around this work?
Same thing as the adult dose. So first dose, and then 3 weeks later, 21 days later, you take your second dose. Once Moderna comes out, it'll most likely be the same interval for Moderna. Unfortunately, with J&J, it's not just one and done. Once the boosters were approved, they are highly recommended to get a second dose 2 months after their first dose.
I'm so glad you're correcting me on that. And I will depart from our kids and COVID discussion to just get you to weigh in on something that we've been observing. So Epicenter has been very involved in vaccine outreach and efforts, specifically in Eastern Queens, which is in Queens Village, was an under-vaccinated zip code. And we've been finding that the J&J vaccine seems to be the preferred vaccine among people who are following workplace mandates, right? They haven't really been vaccinated before. Their employer is saying you must get vaccinated. And because J&J, as I mistakenly just said, has this image of being one and done, I think they're coming to our van. We're seeing J&J in droves, literally. I mean, on a recent Sunday, I think we had like the busiest Sunday we've ever seen with 213 vaccines administered. Wow. The majority of them were J&J, which I've never seen before. So J&J seems very coveted among this population. I just wondered if you can talk about that piece at all in terms of needing the booster, and if our observation from working in this small community, does that resonate with you at all?
It does, and it is for our adult population. So most people just want to get that one dose and satisfy the requirement. Yes, it's providing them protection. And what they've seen is that not enough protection So that's why the recommendation is 2 doses. Now, um, hey, your 200 people that got that 1 dose, that is fantastic. That could start them up with the protection that they need to keep their families safe, keep their coworkers safe. Now, the recommendation now is, even if you've gotten the J&J vaccine or the Moderna or Pfizer, you can interchange for your boosters. So that can provide additional support for them.
And just because we don't know as much about children and the vaccine, do you suspect that children will eventually need boosters? And I mean, I don't know if you can look into a crystal ball for us, but what does that look like?
At this point, no, we don't know. Although a third dose is recommended for people who are in high risk.
Hmm.
So, and some of our kids may be in there depending on what type of therapies they're on and what their high risk conditions are. But right now, probably not.
Okay, that's helpful. So one other, the CDC, I believe they just approved this last Tuesday. I was able to take my daughter, who's 9, on Wednesday, so she was a part of this like early group. It was tremendous. It's been more than a week since then, but it now seems like we were among the lucky, because Epicenter has started to get calls from parents saying, how do we get this? They said they would give it at our kid's school. They didn't have enough doses for everybody. They were there for 3 hours, the mobile van, but the line was crazy. My pediatrician's office doesn't yet have it. I wondered if you could just logistically take us through, okay, everybody believes you, Dr. Ozak, it's safe, they should do it, but now what?
So in New Jersey, we've been ordering through Department of Health task force that they have. And I am really excited to say we received our shipment today, our first shipment of 300 doses. And in an hour, we vaccinated 23 kids, 5 through 11, which is, remarkable. For everyone was ready for this. Everyone was ready for this. So as soon as we received our shipment, we put it out on Facebook. We called our families that are on our list to call, and everyone just came in. So we're really excited that we've gotten our lot of vaccines. So tomorrow I can order another batch. So weekly batches we can request to order from New Jersey Department of Health.
So it'll be every week that you're getting the new doses. And how are you, I don't know if I caught this, but how are you scheduling those 300? Is it like priority? Is it first come, first serve? I know you run a pediatric practice, so it might be different from other people.
So what we did today was from 4 to 5, we just scheduled just for our, I don't want to say our COVID vaccine clinic, but that's what we did. For 4 to 5, we vaccinated. And as you mentioned, my wife is the other pediatrician in the practice, and that's what we did. But we are also vaccinating while we're doing our checkups. We are also vaccinating while, simple cough and colds are not contraindications to any type of vaccine. So we're also vaccinating during those. And our families are comfortable vaccinating the kids during those times. The recommendation is also, if a child needs their 11-year vaccine, they can get the Pfizer COVID vaccine along with their regular scheduled vaccines also.
So we have a question from the audience. This is from Nafisur Rahman. And we touched upon it, but I think it's just worth addressing head on. Nafisur Rahman asks, is the below 12-year-old child getting half a dose of the Pfizer vaccine? So I just wondered if you could clarify that. And we'll try to say it a few times just as folks tune in. Yeah, go for it.
Sure. The 5 through 11-year-olds, they are getting 10 micrograms. So it's actually a third of the dose. The 12 and up, we're getting 30 micrograms. And the 5 through 11, they're getting 10 micrograms. Now, when we do draw up in the syringe, it is 0.2 ml that is being given into the muscle.
Wow. So it's 0.2. Wait, so you just said it's I'm sorry, just so it's clear there's questions.
Sure.
How much is in there?
So
Explain to me how it's 0.2 ml, but it's 10 ml is what you're describing, is the dose.
So no, it's 10 micrograms.
10 micrograms. You see, this is why I'm not
Sure.
a doctor.
It's 10 micrograms in the vial. So it's a completely different vial than the 12 and up. So, there's no mistake about what you're pulling out. It's a completely different vial that you're pulling up. So the formulation and the concentration is different in the 5 through 11 than the 12 and up.
Formula is is it almost like saying a third of the strength, and
Correct.
then the amount that you're putting in the arm is 0.2 ml? Did I get that right?
Correct. The 0.2 ml. And great, and what all of our other vaccines, you come down and help us out. All of our other vaccines that we do administer, most of them are 0.5 ml that we're doing the injections with. This is 0.2.
Okay. And then one question that we have also gotten is, can you get, I think you just addressed this, but again, just to be explicit, can you get multiple vaccines at the same time? So some kids still haven't gotten, say, their flu shot. Can they do that at the same time, or is that just going to really, knock them out or mess something up?
No, they can get the flu shot along with the COVID vaccine. And that's actually what part of a couple of my patients did. They came in for the flu shot and told them we have our COVID vaccine. They got both together.
Okay. We have another question. I want to keep rewarding the audience for asking them, so keep them coming. Jeannie Pinder, who is the founder of Clear Health Costs, as I just mentioned, a significant partner for us in the work we're doing in Eastern Queens. So Jeannie asks, can Dr. Ozak also vaccinate grownups at the same time as kids?
Only if they act like kids. No, yes, we can vaccinate, and we are vaccinating the parents and grandparents who welcome them to our practice to vaccinate them.
And have you been doing this all along, or is it because now you're getting the kids' doses that comes with the grown-up doses as well?
No, we were vaccinating the grown-ups already. We're doing the booster doses. About a month ago, we started it when we were able to get the Pfizer vaccine and the Moderna vaccine. So we have the Pfizer 12 and up. We also have the Moderna.
That's great. Can I ask why you decided to do that, and kind of like what's the population you're observing that's taking advantage of that? It seems like a smart idea if you're taking your kid to the doctor and you're already there.
Yes, and again, that's what it is about accessibility. My child is getting vaccines here, but I also need my booster. So why am I going somewhere else? We thought that it would be convenient for our families to have that option.
That's great. So just one other option for folks in New York City, certainly at Epicenter, we've spent much of the spring helping families navigate vaccines. We know it's not easy. So if you do need help, I'll put our phone number in the on the scroll down here. You would think I'd have it memorized by now, but cell phones kind of really ruined my brain. But I'll get that number up there. You can also email us at vaccine@epicenter-nyc.com. And significantly, on Sunday, we will have ages 5 to 11 and grown-ups. So we're going to give Dr. Ozak a little bit of competition in Eastern Queens, where we're vaccinating adults and kids at the same time on Sunday between 8 a.m. and 6 p.m. Right next to Wyandotte Park. The address is right up there on your screens. We do welcome you on Sunday for sure, ages 5 to 11 and grownups as well, the Pfizer vaccine. And they should have J&J because like I said, that has been very much in demand for folks who are trying to meet, especially those mandates. So one question that so for so long, my family, and I know lots of families who we deal with, were these blended vaccinated and unvaccinated. And so finally, my family has crossed over into the fully vaccinated family of 4. We're thrilled about it. But we know that there are families out there that have kids who are 10 months old, 2 years old, 3 years old, 4 years old. So long before you think there might be a vaccine for under 5. What does life with a child who's recently vaccinated and the ages 5 to 11, parents are vaccinated, but they're still a baby? What does life look like for the vaccinated and unvaccinated blended families?
Again, there are studies in place now. They're doing trials where most likely in early spring of 22, we'll get results of those for 6 months and up to be vaccinated against COVID. So trials are already in place for
Amazing.
that. It does get difficult when we have blended vaccines within the same family. We have to remember it takes 2 weeks after both doses, and again, we're talking about our kids, so I'll say both doses versus J&J. It takes 2 weeks after a child is immunized for their body to create that antibody and to be fully immunized. So yes, during that period, they're still susceptible to receive or get infected.
And so,
And
oh, sorry, go ahead. No, I was just going to
no,
say, so they're still susceptible. And I'm trying to think of the right way to ask you, are you worried about that? Because there's like suddenly a lifting of restriction. And so what does that mean for that child? I guess I think you were heading us to that down that track.
yeah, it's difficult to make those decisions as to, are we going to let Johnny or Nafis or Rahman, go out and play with his friends when he has a younger brother home and we don't know the vaccine status of those other friends. Yes, though again, depends on how comfortable the families are with knowing that there's that risk. Once a child is immunized, we're looking at the data says 90% chance that they will not get the disease or even or have to be hospitalized with the disease. So the studies have also shown that even the transmission is decreased significantly with someone who is vaccinated. We talk about herd immunity. So if you got a nucleus of 5 people in the household, um, you know, 4 are vaccinated. That's pretty good numbers.
Yeah.
The
Yeah.
younger children, under 5, I don't have the numbers in front of me as to how many would be at risk and how many are getting it that young. We do understand that this 5 to 11-year age eligibility now opens up 28 million kids to be vaccinated.
Oh, wow.
Yeah. And 6 million kids during this pandemic have already been infected in this country. And that's just our country here.
Do you, as a pediatrician, feel like the kind of early framing of COVID as really like an old people's virus, like, do you think that was fair? Do you think about that sometimes now in terms of safety for the population that you're serving?
Can you repeat the questions?
Yeah, just like COVID in the beginning was always seen as, not always, I shouldn't be so absolute, but really was framed as a kind of an elderly virus, right? And I just wonder if, you've now been a pediatrician for decades, but for the last 18 months or 20 months during this period of, advocating for children and seeing children, I just wonder if, are we wrong that it's, disproportionately affecting the elderly? Do you feel like, I guess I'm wondering if there are any lessons you've extrapolated from having treated children in a time of COVID.
Again, the information that we get, we are blessed to have peer-reviewed information. We're blessed to have this information easily accessible to us through, FDA, CDC, American Academy of Pediatrics. So the information we had back then, we thought, it was more of a grown-up illness. So, we took it as that. And even through all the data, yes, our kids are getting infected. We want to reduce that infectivity. But, when you compare the 6 million people versus, 200 million people, getting infected. It's not a large number.
Okay.
But I don't want my child to be sick. I don't want any of my patients in our practice, in our families, to have to think about the long-term consequences of COVID.
So just on, again, kind of the note of blending and not blending, how long will it take before a child who's received both, I guess one basic question, you must receive both doses of the vaccine to be considered fully vaccinated, and thus, is the right word, essentially immune? Like, would that feel accurate?
Well, we're never 100% immune. And it also depends on our surroundings. So if our community is well immunized, yes, that provides locally better immune response to an infection. But if our families, there are communities that aren't vaccinating, and I hope there aren't many, but yes, those families are going to be more susceptible.
If you are, this is a question that somebody asked me to specifically ask you, if your child is 11, should you wait until they turn 12 and get the full Pfizer vaccine dose for adults, or should you just get the one at age 11?
Get the one at age 11. The sooner the better. We don't need you to wait a few weeks or months to, again, that period is your risk. So get the dose that you are eligible for at that time.
Okay, that's really good advice. We have another question from Jeannie. I can attest she asks many questions as the good journalist that she is. Can people who are not in your practice get vaccinated by scheduling in advance? How will they find you?
So yes, remember, there is no cost sharing for this Pfizer vaccine. There is no immunization administration cost to any of this, whether it's at our practice or any other practice. No one should be asking any family for money for administration of this vaccine, whether for the vaccine itself or for administration. So we are allowing any community members or anyone to come in and get vaccinated through our practice. We're in northern New Jersey, about maybe 12 miles from New York City. Woodland Park Pediatrics is the practice. It's on Facebook. My Twitter handle is Dr Ozak, and it has our address there also.
Dr Ozak is a great Twitter handle. I'm very impressed. That's awesome. And you just made a point. I hate to gloss over the things that you and I might take for granted. The vaccine is free. I think it's really important to let people know that. Yes. So it is free. And it's free in all the places that we've just talked about. It's free if you go to Dr. Ozak's practice. It's free if you come to the van on Sunday. It's free at the pharmacy. It's free if you go to another clinic or a vaccine site. So, in the early days of doing this work, I kept saying we needed to put signs up next to it saying what the vaccine was and the big words saying it's free, free, free. And I think I've lost sight of that. So thank you. Thank you for underscoring that. So I was getting at this question a little bit around the immunity question. So there's never 100%, but how long did you say after the second dose is somebody considered? What's the right word I should be using? Tell me the right word, and then I'll finish the question. Immunized. Okay, adequately immunized. Then I know you can't tell I've been in vaccines for a year now, but I promise I've been immersed in this. Adequately immunized. What do we think about Thanksgiving, and maybe even look down the road a little bit to Christmas? Like, is it safe to gather? Is it safe to take your 7-year-old over somewhere, with another family or grandparents, for example?
2 weeks. 2 weeks after their second dose, their body is developed enough antibody to protect them against this virus. So, if they got the vaccine today, their 3 weeks is December 2nd. We wrote enough of those on our COVID vaccine cards today, so I remember that 3 weeks from now, December 2nd. And so, Christmas is there. It's there. Enjoy Christmas, enjoy the holiday, time off, the winter break that our kids get. So they'll be ready for that. Yes.
What about travel? And because we are, yeah, we're joined clearly by a audience that is global. Um, what are your recommendations for possible travel over winter break?
You know, as we said, nothing's 100%. Yes, 95% effective. So we still have to take those same measures that we are doing daily. With traveling, yes, you should be comfortable going, but you should still mask up. You should still wash your hands um, so that we're not getting infected.
And I don't know if you've looked at rates, COVID rates in Bangladesh, but does it, so I'm just going to ask whether, does that feel like if somebody says, look, the kids haven't seen their grandparents in 3 years now, can we go? What would you say?
Um, from Bangladesh, I've seen that the numbers are still high. The numbers are still high, and masks probably aren't worn as much as they should be. Again, there are things that you have to do for your family. If this is the best time for you to go, you make those decisions. The risks are there. And I've told families, if you really have to go, this is the time you have to go, please go. But not to go. Look at the area, look at the hospitals. There aren't many hospitals that will take COVID patients. So look at that. Talk to your families that are there now. Speak to them and find out what's going on in that area.
Yeah.
Before you make that large purchase for that plane ticket.
I know, and the prices are crazy. I just looked at plane tickets for Assam. My cousin's getting married right before Christmas. And similar situation, we have a 9-year-old, so she has not been on a plane in a year and a half, but it's partly the plane tickets that might decide us not going. It's not as much a safety issue. It's like $2,500 for a ticket. So yeah, it's a lot. And what about your own family? What are you doing in terms of travel? You said you love to travel. You have a daughter. What have you been doing through the pandemic, and how does vaccines change your life now?
Prior to the pandemic, every even year we were going abroad. Turkey, Europe, Spain, Bangladesh, Dubai, Costa Rica. So we were going abroad every even year. We are delayed. We haven't been able to go anywhere, but understandable the reasons. We've done local things. We've done Florida, driving down in Myrtle Beach. And of course, we have a lot of friends in New York. We go out there, Ithaca. We take trips out that way. Unfortunately, I just realized a few days ago my passport has expired. So same with my daughters. My wife said it's good till 24, but both of ours expired this year, and I just realized that. And we have an appointment on the 23rd to get our passports renewed. So yes, we will be heading out somewhere once we get once we get our passports done.
Wow, that's exciting. I think we're going to end up doing domestic as well. So that's similar to our family.
Safest.
Yeah.
And of course, this country, there's so much to see and do in our country here. So if you don't have to, enjoy something locally.
Yeah. I think the challenge is that for so many of our families, they're like, it's not even extended family, right? It's direct family is overseas, right. And that becomes the impossibility. So speaking of the globalized world, more questions from Jeannie. What if someone is not documented for residency in the US? Do I have to be documented and show ID for myself and my child if I come to you? Has this come up in your practice?
It has not come up, but there is no question about where you are from, and are you legally in this country, what's your visa status? No, you're here, you're for a vaccine. That's all we want to do. We want to vaccinate you.
That's great. That's great to know. And similarly for our van, we do have volunteers on site who are very familiar with the documentation and can help guide you through that. And again, if you have questions, we're happy to help you navigate that. Our phone number and our email have been scrolling across. It's 917-818-2690. See, I do have it memorized. 917-818-2690. And that is our main number, but it really does come to my cell phone and I answer every phone call. So please do let us know if we can help you. It's not my cell phone number in case some of you are like, wait, it comes to my cell phone number. So another news story I saw yesterday was that our incoming mayor, Eric Adams, said that we might be in a stage where masks can be removed in the classroom. I'm wondering what questions you've been getting from families about this, what you think of that, what becomes of the mask among vaccinated children?
So, once the vaccine rates go up, remember, part of CDC's guidelines was if you're vaccinated, then you can have your mask off. So I think all of our students' chairs and tables are still separated. So by I think 3 to 4 feet now anyway. So I don't think that's a problem. If our kids are vaccinated, then yes, they should be able to remove the mask.
But you feel comfortable with that?
I would feel comfortable with that. Yeah.
Okay. And the challenge is, you just said if they're all vaccinated, we know that for many, I think one other just trend we're seeing is some families saying, it's not that I am against vaccines, it's just I might want to wait to see how this goes, right? I've heard that from some families in our neighborhood, which then leads to this period that I think we might be in for the next 2 months of classes emulating what I just described of families being blended between the vaccinated and unvaccinated. It sounds like in that scenario, you would keep, which population keeps masks on? Everybody? The unvaccinated? How should that work?
Yeah, it should be the unvaccinated because your germs are the ones that are coming out. They should be wearing the masks.
Okay.
We're wearing the mask to protect ourselves. So it should be those that are not vaccinated. They should be wearing those masks.
Okay. So did you started giving the vaccines out today in your office?
Yes, today.
What was the most memorable vaccine you gave out today?
Oh, of course. When they came in for the flu vaccine, I said, "Hey, we have the COVID vaccine, 5 to 11. It's here." And that one patient said, "Let's do it." So again, as you see, I just perked up so much just talking about that experience today. So it was wonderful that our families trust us. Again, sometimes I talk about, these are the things that we've done with our daughter. And we hope that you understand that as a physician household that we have, with my wife and I, both physicians, we trust in science. We want to vaccinate. This is what we do in our household, and this is what we recommend for your household also.
That's a great message. So we're going to start wrapping up, but if anyone has any final questions, do post them on whatever platform you're watching on. We will try to squeeze them in. I know, Dr. Ozak, you're going to think this is a test. I don't know if your family back in Bangladesh is watching. I can make sure that they catch the replay. But I was just wondering if you have a message for parents in the Bangladeshi community in Bengali related to vaccines, COVID, really wherever you want to take this. I'm sure they would welcome it.
No, আপনাদেরকে সবাইকে চাই আমরা আমাদের সবাইকে সেফ রাখার জন্য। কেমনে সেফ রাখবো? আমাদের কমিউনিটিটাকে ভ্যাকসিন দিয়ে। সো আমাদের বাচ্চাগুলা সবার ভ্যাকসিন লাগবে। 5 to 11 এখনো অ্যাপ্রুভাল হইছে। আপনারা ওটা ভ্যাকসিন আপনার ডাক্তার অফিসে যান, আপনাদের লোকাল হেলথ সেন্টারে যান, ভ্যাকসিন দেন, ভ্যাকসিন দিয়ে আমাদের সবাইকে প্রোটেকশন দেন।
That was pretty good. And you didn't rehearse that. You didn't know. That's great. That's great. So before we conclude, I'm just wondering, are there any final thoughts or anything I didn't ask you, any kind of burning message that you want to convey to our audience?
No, I think the vaccine is safe. Get it done and go enjoy life like you did back in 2019. In the next, spring, early spring, we should have the data on the kids 6 months and up. So, we're looking ahead And I think we're doing very well in trying to get out of this pandemic. We have the resources now. Let's use them.
So we don't have a question, but we do have a shout out to you from Nahid Rashid. And he says, "Hi, Man and Uncle, this is Ashaz." Which
Thank you.
I love our community because they show up. I mean,
Yes.
you got to give them. I mean, when I say our community, I'm not Bangladeshi,
But
but I border Bangladesh, so I've been included in many a TBN program and many a Bangladeshi event. So thank you.
thank you, Ashaz.
It's so sweet of you. So that's a wrap. This has been wonderful. I want to thank you, Dr. Ozak, for a really, really informative. We went from the basic to the profound to the Bengali, and I'm so, so grateful that you were our guide in this moment. It's a really exciting time if you do have kids ages 5 to 11 in terms of getting, to quote Dr. Ozak, some of our life back. And we're, I think, really looking forward to that. I just want to thank our co-sponsors here, TBN24. I want to thank Jeannie from Clear Health Costs that's been working with us in Eastern Queens on our vaccine equity grant. I want to once again say that our work is made possible by the Fund for Public Health in New York City Department of Health and Mental Hygiene, great partners they've been. And if you have any questions, please don't hesitate to reach out to Epicenter to help you navigate not just vaccines, but this moment in the pandemic. We're very much here for you. We'd love to hear from you. And we will catch you on another live stream soon. Thank you so much.
Thank you.